I want to thank you all for sticking with us this afternoon for our next panel, our next topic, which is about making progress happen. All of us are working very hard every day in our states to spur economic growth and to build lasting career pathways that put more people to work in good-paying jobs. It's more important than ever that we work together to find new ways to build a steady pipeline for the future, using economic development models, infrastructure projects, and talented, well-trained, and well-skilled workers. The governors obviously play a key role in these efforts. Many of the governors here today have shown tremendous leadership in this area, and it's at the state level that bold ideas are being developed and real solutions are being forged. So to lead today's next panel, it is my privilege to introduce the Vice Chair of the NGA, the Governor of the great state of New York, Andrew Cuomo, who will tell us a little bit about the progress he's making in New York and then lead the next panel discussion. Please welcome Governor Cuomo.
Thank you. Good afternoon. Before I get started, let's give a great round of applause to our great chairman of the NGA, Governor Hogan. Governor Hogan, we all thank you for your professionalism, your collegiality, your cooperation, and your leadership. Another round of applause for Governor Hogan, please. It's my pleasure to be here today to open the second plenary session, and let me tie the discussion of this session into the last one on global and domestic infrastructure. To begin with, if we had a magic wand, we should wave it and eliminate the word infrastructure from the vocabulary. It is just not an attractive word, let's be honest. Maybe if we come up with a more attractive word, we could actually entice the federal government to re-enter the field. It sounds like a task for a new NGA subcommittee. But the simple truth is that we do need the federal government to be a full partner if we're going to resolve this crisis. And it is a crisis. States simply don't have the financial luxury of filling the void, no matter how aggressive, no matter how creative states are. This is not a partisan complaint, because the past 5 presidents, Democrats and Republicans, all proclaimed infrastructure development as a national priority, and very little progress has been made. Our national infrastructure funding deficit is estimated to be $1.5 trillion by 2025. European countries, on average, spend about 5% of their GDP on infrastructure. Our federal government spends less than half that. In 1977, Washington paid 38% of the cost of building our nation's infrastructure. Today, that share is down to 25%. And the ever-increasing balance falls to state and local government. In the meantime, states do what we can, and states do what we must. We know that what we build, what we modernize, is the legacy that we leave behind. Given a state's limited resources, a state development strategy must be targeted and have a direct connection to a return on the state's investment. They must be catalytic to an economic development plan. Either the project itself must be essentially self-financing, or the project must be an integral part of a targeted economic development strategy that will pay dividends. In New York, we analyze our development projects in 2 tiers. First, necessary and essential modernization of our transportation systems. And second, regional economic development and investments. First, global competition demands a modern transportation network, period. Either grow or be left behind. In 2014, then Vice President Joe Biden said, basic quote, "If you landed in New York at LaGuardia Airport and you were blindfolded, you would think that you landed in a third world country." Dramatic quote. Now, all the New York politicians criticized the vice president for slandering a New York airport. we can be a little defensive as a group in New York. But I actually went the other way. And I said, no, the vice president was right. Let's recognize the truth. My state, every state, needs a modern airport to enter the global economic competition. Look at what they're building around the world. And then look at what we're doing here in the great United States of America. If we want to keep pace with the rest of the world, we have to update our transportation network. And if the federal government won't do it, the states must do it as a basic matter of economic survival. Now, states getting into this business bring significant financial challenges for a state as well as a highly specialized expertise. States don't have the funds to do it without leveraging public-private sector partnerships, and that's the discussion we had on P3s. But it's truly the only vehicle to get the amount of funding a state would need to make a real difference. On airports, for example, what that meant for us in New York was the private leasing of the terminal space at airports at the beginning of our construction projects to pay the cost of the construction. We're building a new LaGuardia Airport, which is going to be the first new airport in the United States since the Denver airport opened in 1995. It's an $8 billion project with about 1/3 coming from government, 2/3 being paid from private sources. To actually build it, we have adopted the design-build method. The state will master plan the project, but we then bid out the design and the construction to a private company with a set completion date, an incentive for early delivery, and a penalty for late delivery. The old adage, know what you don't know, and government does not know how to build. New York recently completed the largest infrastructure project in the United States, a bridge across the Hudson River with a price tag of $4 billion. It was completed on time and after many sleepless nights on budget. It took about 4 years. Building public confidence in government's capacity to actually complete these big projects is essential if we are to have the political will to move forward on an ambitious building agenda. We want the federal government to know that the people of this nation want this kind of leadership and participation. That means the people of this nation need to know that if we embark on this venture, we can get it done, and we will get it done, and it will happen efficiently and effectively. We're now in the middle of the largest building program in New York State's history, $275 billion in infrastructure. We're rebuilding our airports, the LaGuardia, JFK, our regional airports in upstate New York, train stations, mass transit, roads, bridges statewide. All projects incorporate resiliency. We are ensuring 100% statewide broadband and cell service as basic economic necessities to attract business to the rural parts of our state. But these development projects are basically essential for economic survival. And if the federal government will not step up and fund them, then the state must. At the same time, we have a second level of construction and investment, which are basically regional development programs, where we identify the economic potential within a discrete region of the state that needs help. We invest in those projects necessary to bring that economy up in that region. And those projects are tailored specifically to those regions. For example, northern New York, we have the Adirondacks. Their economy is basically based on tourism, outdoor recreation. So there, we're building new lifts, new lodges, new attractions, new roads, new hotels. Long Island is a different region of the state, and we're building an economy based on our concentration of academic institutions and biotech development. We're trying to steal a page from North Carolina and have our own research triangle on Long Island, and we're financing laboratories and schools and new rail transportation. Syracuse, in the central part of the state, we're developing a cluster economy on unmanned vehicles and drones, and we just built a 50-mile drone testing area, one of the largest in the country. But these regional economic development plans are originated by business leaders in the region working with local elected officials, and the state comes in to provide the investment capital. So far, we've spent about $25 billion on these regional economic development projects, $18 billion from the private sector, $7 billion from the state. But the point is, again, regional development that grows the economy, because we need the economy to grow to pay for the capital investment that the state made and further those economic advancements. In closing, my last point is that while we all hope for an active federal partner, the reality is that after such a long delay, I think the best course forward is for the states to hope for the best and plan for the worst. If the federal government decides to embark on an aggressive building program, which we all will advocate for, they're going to look to the states to find projects that are ready to go, right? They're going to turn to the states and ask for shovel-ready projects. We saw this in 2008 when the federal government started a stimulus program and went out to the states and said, give us your shovel-ready projects. Now, it's very hard to have a shovel-ready project before you have the financing. But for states, we're doing the best that we can to have those projects ready once the federal funding becomes available. We are investing a record amount in buildings. So people often ask me in this state, is this economically prudent? I say, look, first, we must recognize the economic reality. We're all in international competition for the same businesses and the same jobs. And the locations that better serve the private market will win, whether they are in China or Europe or Utah or Texas or New York. To me, the question is, can a state not afford to grow its infrastructure and its economic capacity? Second, in New York, we have never forgotten what drove our original success. Yes, we have New York City, which is on the seacoast, and it provides a great natural harbor. But that did not exclusively drive our economic growth. 1817, the nation was looking for a way to open up the West. At that time, the West was basically west of the Mississippi. Thomas Jefferson and George Washington were planning a series of canals from the Potomac to access the West. In New York, Governor DeWitt Clinton, no relationship to Bill Clinton, said he had a plan. His plan was the ships could come into New York Harbor, go up the Hudson River, make a left at Albany, and come out across the state at Buffalo, which is on the Great Lakes, and then from the Great Lakes you can take a river down and you'll be in the quote-unquote West. Skeptics said one question: when the ships make the left at Albany, how do they get out at Buffalo? That's 400 miles, all landlocked. Governor DeWitt Clinton said, no problem. I will build a canal that goes across the state, and we will pull the barges with horses and mules. 1817, 400-mile canal. The people of the state thought it was so crazy, they tried to impeach him on the grounds of insanity. But he did it. 7 years on time and on budget, and he built the Erie Canal. And that really was the infrastructure that made New York a commercial engine. But that is the innovation. That is the daring, the ambition, the spirit that built this nation. And it still lives in every governor and in every state. As Sarah Rhodes said on an earlier panel, the line from the Kevin Costner movie was right. If you build it, they will come. The line was right. The name of the movie was wrong. It's not a field of dreams. This is a country of dreams, because we are a nation of dreamers who had the skill, the tenacity, and the courage to actually make it a reality. And we did it, and we can do it again if we just have the wisdom to work together. Thank you. Now it's my pleasure to introduce Governor Herbert. Last summer, we all got to see with our own eyes at the summer meeting in Salt Lake City how Governor Herbert has been making progress happen in his state of Utah. The people of Utah have been lucky to have him, so has the NGA. No one loves the NGA more than its former chairman. Thankfully, Governor Herbert is not leaving us until the end of this year, so we're going to lean on him until then. Let's give a big welcome to our dean, Governor Gary Herbert.
Well, thank you, Governor Cuomo. I am honored to be here and take a few minutes with you today. And as this is my 11th winter meeting, it gives me an opportunity to tell you thanks for all the contributions that you and your predecessors have made to me as I've come here and listened and learned and been able to, in fact, translate some of that wisdom that you've imparted to me into the success of Utah. I recognize that we all are a little bit different. We have different cultures, different backgrounds, different politics, and so what I say today kind of is emblematic of what's happened in Utah, and maybe you can learn from some of the things we've done, and certainly I can learn from you. I appreciate Governor Cuomo's comments about dreaming and the possibilities. Again, I live in a state that really was built upon dreams and possibilities and trying to, in fact, work together in what was originally then a public-private partnership. Those early pioneers that came to Utah to try to make the desert blossom as a rose. So with that being my beginning, let me just mention a couple of things that I make an observation. The topic assigned to me is investing in the future, economic prosperity, and public health. I would make this observation that the wealthier you are, generally speaking, the healthier you are. You have access to better quality health care. So having a focus on economic development and growing the economy is important for all of us. It's how you pay the bills. Whether it's infrastructure needs, which we focused on here today with Larry's initiative, or it's paying and funding education, health care, whatever your issues are, and they vary around the country. Again, having a healthy economy helps us pay the bills. Secondly, again, New York's about 108 years older than us. I'm a new state. So we can learn from those who've been down the trail a lot longer than us. And some of the new innovations that are coming as we've embraced technology are things that we've been able to appreciate, maybe get on board a little quicker than some of the states. But the focus really for all of us should be on economic development. And in doing so, understand, this is a Herbertism, that capital is a coward. Capital either flows in or out based on how it feels. And if it feels welcome, capital will flow to your respective states, your regions, to your businesses. If something is amiss, it will find other places to go where it's more welcome. So what we've tried to do when I came into office at the depths of the Great Recession was to kind of reset our compass and say, what can we do to, in fact, improve the conditions in our state of Utah to have a focus on coming out of the economy and become the best economy we can possibly be. We wanted to be the best, the number one in America, and also add to our opportunities to be an international business destination. And why not? We speak 130 languages in Utah, so we are built to do international business. And in doing so, basic principles were something that we embraced. For example, we have competitive tax rates. We have flattened out our tax rates. That happened under my predecessor, Governor Huntsman. We flattened it out so that they're now, and they've been lowered since then, to below 5%, about 4.95% flat rates for personal and corporate income taxes. We've also wanted to make sure that we streamlined our regulations. We actually went through and counted the regulations in our statutes and the regulations that have spawned, and found that we had 368 of them that had really no public purpose. It didn't level playing fields, make an equal opportunity. It was not designed to help keep the bad people at bay. It was just kind of a drag on the economy. And so, as you would do, we in fact removed those regulations and said to the marketplace, we're open for business. We don't want to have things that are just going to make it more difficult for you to in fact be successful as a business enterprise. We also wanted to find a way to make government more efficient. We understood, as you do too, that government is a monopoly. Whether we are good, bad, or indifferent in how we spend the taxpayers' money, generally doesn't mean any difference to whether we're going to be around next week or next year or 10 years from now. In the private sector, that makes a big difference. If you don't, in fact, compete, as has been mentioned here today, the competition from China, it's a global marketplace. It's not just in our respective regions or states. It really is a world competition now. The private sector, if we don't compete properly, we'll lose profit, we'll lose market share, and then we'll lose our business. So recognizing that that's not the same rules that government has to play on, we actually brought in our cabinet, our senior staff members, and said, what can we do to find more efficiencies in our state government? Everybody bought into it. We developed what's called the Success Program. We won't have time to go through that today. But in doing so, we said we can find more efficiencies. And in doing so, save taxpayers' dollars. And so just to give you an example of two things that we've done, emblematic of many things we've done, today in the state of Utah, we actually have fewer state employees than we did back in 2002. You have to go to 2001 to find a smaller number. That's 19 years ago. In the meantime, we have over 900,000 more people that now call Utah home. More demands on state government, but we're providing it with fewer labor, technology and better processes. That saves on average now and growing about $400 to $500 million per year for the taxpayers if we just had kept up with inflation or just the rate of growth. And what we've also done, the Department of Motor Vehicles, which we know is kind of used as a bad example of state government, our Department of Motor Vehicles, the DMV, the average wait time now is less than 5 minutes. So we're doing things a lot more effectively and a lot more efficiently with making our government more effective. Last but not least, the entire effort here is to try to empower those in the private sector. We do believe in private-public partnerships. Most everything we do is with a private partner. We contract on roads, we contract on buildings. Some of the services we provide, we contract and have competition and bidding that takes place to make sure we get the best and most efficient use of the taxpayers' dollars in providing services. We've had great success in that to the point that right now, where we don't spend more than we take in, as we're just like a business, we're saying you got to run this and live within your means. We have one of only 12 states today that have a AAA bond rating from the rating agencies on Wall Street, which allows us to borrow money at a lower cost when we do construction. We don't use any one-time monies for ongoing needs. We don't have any structural imbalances. And so the fiscal prudence has allowed us, in fact, have a good solid foundation for growth of the economy in the private sector. Last but not least, let me talk about some of the things we've done too. I had the opportunity, as some of you did, to hear from the second lady, Karen Pence, and talked about the need for us in our regulations to see what we can do to have reciprocity between the states, particularly with our military personnel. 4 years ago, we said to any military personnel that are moving into the state of Utah, if your spouse is a licensed whatever, a lot of them were teachers, if you're licensed in another state, if you're licensed in New York, if you're licensed in Maryland, when you come to Utah, that license will in fact be accepted. To help them find jobs and honor our military and their service, that's been a good thing for us and has helped. Our unemployment rate now in the state of Utah is 2.3%, the lowest in the nation, lowest in our history of the state. And our unemployment for our veterans is 2%. So even lower because we've helped in many ways with our military people. One of the other things that I'm most pleased about, again, he's running for president, but I had an opportunity to meet with Mayor Bloomberg, and they did a study on Utah and found in their analysis that the largest middle class that we have in the country today is located in Utah. So we've been able to have significant economic expansion and growth. We've created on average 3.7% new jobs in the private sector for the last decade, the most healthy economic decade in our state's history. And that's a pretty healthy growth rate. We now have more jobs than we have people. Our challenge now is labor. And we've emphasized skills and training with our education, post-high school, and we've emphasized vocational and technical training to fill some of the voids that are out there now. but we've been able to lift people out of poverty in a significant way this last decade to the point that we now not only have the largest middle class, but we have the third lowest poverty rate now in the state of Utah that we have in the nation. So with that, again, we've had some great success. We're happy to share with you our success. It worked for us. It may work for you. We're happy to share what we did and how we did it. Last but not least, when it comes to infrastructure, we've spent, when I first came into office, we're spending about $100 million on highways and roads. We now spend on average every year now about $800 million on roads and have bonded for some others. So we understand what's being talked about here, the importance of infrastructure to allow not just for quality of life and ease to get from point A to point B, but it is an economic development tool. Businesses won't come if you're in constant gridlock. So our investments in our infrastructure, roads and highways and byways has been a big deal, and it continues to be a big part of our budget today. We also have created just outside of our airport an inland port. Again, trying to find ways for goods to come into the country without having to go through the coast necessarily, which are kind of backed up, to have an inland port. Some of you have done this already, where we have rail and highways and air all coming together, help us reduce pollution, help us concentrate in an area that makes it easy for commerce to come in and out of the state of Utah and in and out of the country for that matter. And along with that, we will have a new airport. We're remodeling our airport. Some of you have been there many times. We appreciated having you there last year. But we are now going to open up the new airport, which is going to be completely remodeled and reconstructed, $4 billion cost. Will be starting to open up in this fall of this year. So again, we talk about being the crossroads of the West in Utah. If you look at the map, we're just kind of the bullseye right there between Canada and Mexico and the Midwest and the West Coast. But we're doing things to enhance that opportunity. As Governor Cuomo talked about, it is a matter of us working together, finding ways to find new ideas to, in fact, fulfill the dreams and hopes and aspirations we have, not only for ourselves, but more importantly for those who come after us, our children and our grandchildren. So again, I think all of us can, in fact, learn from each other. That's what the NGA is about. So I thank you for all of the contributions you've given to us to help Utah become the best that they can be. Thank you very much. Now please welcome back to the stage the great Governor of New York, Andrew Cuomo.
And let's give our dean another round of applause. Governor Herbert, thank you very much. We were chatting this morning as governors in an executive committee and talking about how governors, at the end of the day, we have to get a job done. And that's why learning from each other in a bipartisan way is so important. And whether it's infrastructure or economic development, there are lessons that we can learn. One challenge we all have is public health. The vaping crisis that is going all across this nation and is spreading with a frightening facility among our young people. We have two great governors who are going to speak to us about it now. It's my pleasure to introduce Governor DeWine from Ohio and Governor Brown from Oregon. Thank you.
Got our guests up? Good. All right. Hi. Good afternoon. Good to join you. It's good to see you. Thank you. Good afternoon, everyone. I'm Kate Brown, Governor of Oregon and Chair of the NGA Health and Human Services. Thank you, Governor Cuomo. Thank you, Governor Herbert, for your great remarks. And I appreciate everyone's patience as we took a set break. So I am delighted that all of you are here today to join us to talk about a critically important issue that's facing our young people and our states, and that is the nicotine epidemic and the health crisis, the public health crisis that we all know is vaping. It is claiming too many lives, and it's making countless of our community members sick. And well, the nicotine addiction is not a new issue. The vaping epidemic gained national attention this last summer when we learned of the outbreak of lung injuries and deaths associated with e-cigarettes and vaping products. Many of these products may contain nicotine in addition with other chemicals and additives. As of January 21st, 2020, a total of 2,711 cases of hospitalizations have been reported from our 50 states due to e-cigarettes and vaping products, including 60 deaths confirmed in 27 states and the District of Columbia. I am delighted that we have two panelists joining us this afternoon. Doug Blanke, President of the Public Health Law Center, and Matt Myers, President and CEO of Campaign for Tobacco-Free Kids. Thank you so much for joining us this afternoon. So I know that a number of the states are taking very aggressive action on this issue. In Oregon, the vaping crisis has been really challenging. Among our 11th graders, we've seen use of e-cigarettes increased by 80% between 2017 and 2019. And I know others of you are seeing these incredible statistics. It's an extremely costly and deadly epidemic, and I believe we need to take action to ensure the safety of our young people, our constituents, our friends, and family members. It was very encouraging to see Congress and the administration taking action and mirroring what 19 states and the district have already done to curb this crisis by raising the federal minimum age to purchase all tobacco products from 18 to 21. In addition, the FDA last month announced they will begin to enforce policy on the selling of unauthorized flavored e-cigarettes except for menthol flavors. It's a really good first step, and I, like many of you, believe there are a few more steps that we can take. So I know a number of you have been extremely active in addressing the vaping epidemic through legislation, executive orders, emergency bans, and a number of state actions. In Oregon, we raised the legal age to purchase for tobacco to 21. We did that in 2017. And additionally, in October, I issued an executive order to take immediate action on the vaping crisis. We've also strengthened our regulatory system, launched a public awareness campaign, improved rules for product testing and labeling, and last week I convened the first meeting of Oregon's Vaping Public Health Work Group to address the epidemic of vaping-related illness and youth vaping in Oregon. So I'd love to turn the conversation over to Ohio Governor DeWine for opening remarks, and then we'll turn it over to our panelists.
Good. Governor Brown, thank you very, very much. In Ohio, we also raised the smoking age to 21. We raised the age to vape to 21. We also started, for the first time, actually taxing vaping as well. And we're putting a lot of emphasis in regard to all addictions, in regard to education. We're doing something that's not been done, at least in Ohio, before, and that we've set aside $675 million for our schools for wellness, and certainly social emotional learning, and this certainly, big umbrella would certainly cover vaping and the e-cigarettes as well as tobacco. Really, I think with the vaping, there's two separate problems. One's the immediate problem that we see. We've had about 100 people so far that we know of that have been hospitalized in Ohio with severe respiratory problems because of the vaping. That's what you see. That's what makes the news. But the long-term problem, I think, is much more serious. We have made some real progress in this country in the last few decades in regard to our youth smoking. The numbers have come down dramatically over that period of time. But in the last several years, we're starting to really completely reverse that. We're seeing up to 25% of our teenagers who are vaping becoming addicted to nicotine. And what we're seeing is they really have taken a playbook from big tobacco. They're using the same techniques that tobacco used for many, many years to addict young people and to get young people hooked. This is something that Matt Myers and I dealt with when I was in the United States Senate, and we tried to deal with those tactics. But these folks are very, very, very good. They're really addicting a new generation. Same tactics that big tobacco used. The fruity flavors, doing all the things they could to make it look cool. They have a device that looks like a flash drive. Not only does it look cool, but it's also pretty easy to hide from parents or hide from teachers. So this has been a very, very sophisticated marketing technique that very tragically is working very, very well. I applaud the efforts the federal government has made. I think that's a good beginning. FDA can probably go a lot further, frankly, into kind of closing some of the loopholes that are there. But we're at least moving down the pathway. But this is just a huge health challenge. If we look at the ramifications of 25% kids becoming addicted to nicotine, and we know how very addictive nicotine is, that's a very, very frightening thing with long-term health implications and certainly long-term implications in regard to Medicaid, for example, and our Medicaid costs that we face in each state.
Thank you. And over to our panelists.
Thank you. Thank you, Governor Brown, Governor DeWine, and the NGA for the opportunity to be here. My name is Doug Blanke, and I lead a nonpartisan, nonprofit legal center in the Twin Cities where we have 15 attorneys specializing in these issues that we're discussing today who are ready to help you and your staff and your legal counsel as you wrestle with these issues that we're discussing. Our folks are already working with your staff within your health department, so please let us know how we can be helpful to you. We want to do that because, like you and Justice Brandeis, we truly believe that the states are the laboratories of our democracy, and it's where we experiment until we get it right and find the path forward for the nation. There's nowhere where that's been more true than in this field of tobacco control, where virtually every major advance in history has originated at the state and local level. And never have we needed your leadership more than we do now. As the governors have said, this vaping crisis has exploded upon us. For 20 years and more, we had made slow, painfully slow, but steady progress in reducing youth smoking. 20 years ago, when I was relatively new in this field, we had 28% of high school kids smoking cigarettes. And through a lot of blood, sweat, and tears by many people in this room, we have now brought that down to 5.8%. We might even be saying that victory was almost within our reach if e-cigarettes had not exploded upon the scene in the last 5 years, driven by slick design, fancy flavors that attract kids, and technology that allows nicotine that can be twice as potent as that in cigarettes. We have now suddenly reached the point that while cigarette smoking is down to 5%, the use of e-cigarettes is up there at 28% and continuing to grow. So we have to do something about it. My focus this afternoon is going to be on the balance between the federal responsibility and the state responsibility. It's been a decade now since Congress gave the FDA authority over tobacco products. And in that time, what we've had is kind of a dance between the feds and the state to figure out the respective roles that each should play. And I'm going to speak to the two latest steps in that dance. The new federal legislation raising the age of sale to 21, and the announcement last month by the FDA of a new enforcement policy on flavored e-cigarettes. First of all, the age of sale. This new federal legislation, which is often referred to by the nickname T21, was enacted in December. How does it affect you and your states? What do you need to know, and what can you do about it, or what do you want to do about it? First of all, it just has to be said that there is going to be a certain amount of confusion in most every state as this gets implemented, because in most states there is a state law that doesn't necessarily align with the new federal law. Even if you're one of the states that has gone to 21, you may well have exceptions, for example, for military personnel. So the new federal law enacted in December, when did it take effect? It took effect immediately. It is the law now. What does it say? It says no one is allowed to buy, or no one is allowed to sell tobacco products of any kind to persons under the age of 21, no exceptions. So it's on the books. When will it be enforced? Well, the FDA won't be enforcing surely before September, when they've completed writing the rules for enforcement. Can you enforce it? Well, if you've enacted a law that aligns with the federal law, you can enforce that. If you have a licensing system for your tobacco retailers that makes reference to their duty to comply with federal law, you could consider a licensing action. Other than that, you will no doubt be in a gray area. You should also anticipate some questions involving what is called SINAR checks. If you're not familiar with that term, SINAR checks are testing, sales testing that's done anonymously, that's required for you to continue to receive your federal block grants for substance abuse from SAMHSA. Those may be done under contract by an agency of your own state government, or in a few cases by others. And those will now be done using the 21 standard, whether or not that aligns with your state statute. So again, there's going to be some sorting out that has to happen with all of that. Is there a way to clear it up? Yes, if you can get your legislature to bring you into alignment with the feds, and I think Matt may be speaking to that. Let me now turn to the other latest federal development, the newly announced enforcement policy from the FDA with regard to flavored e-cigarettes. The first thing I would like you to know is that this new policy is actually an FDA enforcement policy. It's not a ban. And what do I mean by that? This most likely would come as a surprise to most people, but the fact is, under the Federal Tobacco Control Act, every e-cigarette on the marketplace today is in the market unlawfully. Let me repeat that. Every e-cigarette in the marketplace today is there unlawfully. These are, you could call them, undocumented products. And why is that the case? Because the design of the federal law, once the FDA asserted authority over this form of product, the FDA law says nothing is to be sold until information has been submitted to the FDA for their review and approval, and none of these products have been approved. What is happening instead is that the FDA is using its discretion when it comes to enforcement to say they aren't going to enforce that law against most of those products yet. And what has happened now with this new policy is a change in that position. They have said they're going to use their enforcement discretion differently, and they will start going after some e-cigarettes. The new policy, as I say, is one to use their discretion to go after some products, some flavors. You could say kind of picking winners and losers as to who they're going to go after. The time today doesn't allow me to go through all the specifics of who it is, but suffice it to say this. A main cause of the vaping epidemic is the proliferation of all these flavored products. More than 1,000 different flavors out there appealing to our kids. Not just familiar flavors like menthol, but candy and fruit, and even flavors like cotton candy or bubble gum flavor of products. As this problem gained more attention and was considered by the FDA for the last year back and forth, opponents of any changes organized and put pressure on the FDA as it developed its policy. Vape shops, manufacturers of these products, tobacco companies. And as a result, after a year of going back and forth, the FDA has announced a policy that I can only describe as a bit of a mishmash, saying that they will act against some flavors in some types of products, but not others. The reason we have this bit of a muddle is, I think, due to an understandable instinct on the part of the OMB as they reviewed this process to try to strike what they felt was a balance between the health concerns and the voices of those saying there would be economic consequences to any change, whether there was really any evidence to back that up. So there was an attempt to strike a balance by targeting certain products on the theory that these were the most popular products with kids. They looked at the latest surveys and tried to target the types of products and the flavors that they felt were most popular. In the end, you could say they may have tried to please everybody and ended up pleasing no one and confusing everyone. The example that comes to my mind is, imagine, governors, if you were going to try to address the problem of teen drinking, and you went to your legislature and said, we've got a survey that says the most popular kind of liquor with teens is peach brandy. And so my teen drinking program is to ban peach brandy. Well, you know, that would be great for the first week, but do you think kids might find their way to strawberry wine or, you know, cherry vodka? Well, to us, that's kind of where we are with this new process. And the resolution of that, the best resolution, is to look back to the states, to you and your legislatures for a solution that Matt will talk about. And now in closing, I couldn't give up the stage with also inviting you, governors, to think not only about these immediate problems, but to step back and think about a much bigger problem. If you address this issue, you will take a bite, an important bite, out of the tobacco epidemic. But we've been taking bites out of this epidemic for more than 50 years, since the first Surgeon General's report. And here we are, 50 years later, with 500,000 Americans dying every single year from these products, and no end in sight. Honestly, I doubt that there's a single person in this room of any political philosophy who wants to see our grandchildren and great-grandchildren grow up in a world surrounded by these addictive and deadly products, or who wants the NGA to be reconvening 50 years from now with another workshop on what to do about tobacco products. So my question for you is this: isn't it time to start a conversation about where we're going? Isn't it time to think about when and how we will begin a process of phasing out these products altogether, beginning with cigarettes? We won't do it this year, we won't do it next year, but in this century, hopefully long before the end of the century, long before the end of our lifetimes, hopefully sooner rather than later. And if that still sounds like a crazy proposition, my request to you is to think about that with an open mind and to float that question with some constituents that you trust. Not your staff, not your political consultants, but with constituents you trust. And you might just find this is one of those areas where the public might be out there ahead of the political professionals, the policy wonks, and the pundits. Thank you very much.
Thank you very much, Doug. Matt, take it away.
Sure. My name is Matt Myers. I'm the president of the Campaign for Tobacco-Free Kids, and thanks for the opportunity. We come at a time where there really is a crisis. And I want to thank Governor Baker, Governor DeWine, and frankly, a host of other governors here who have highlighted the importance of this and taken the strong action. You've heard numbers, but they're really important. Between 27 and 30% of all kids in the United States are currently using e-cigarettes. What's particularly disturbing is if you look at that population in very large numbers, it's kids who never would have smoked. It's an entire new population. The other critical fact to understand is that this e-cigarette of today is very different of the e-cigarette of 5 years ago. It delivers nicotine more rapidly, more intensely, and more effectively than, and I want to underline this, any product ever delivered, so that we're seeing a level of addiction among our children. It's not experimenting. Kids are starting to use these products, believing they're a safe alternative, and finding themselves within a week or two heavily addicted. The tale in high school after high school is I started it because it was cool, and I'm doing it because I can't stop. States have got to take the lead on this issue. The new federal law raising the age to 21, as it rolls out, is a tool, but it's not a solution. It will help you move forward. And frankly, it is the law right now, so that those of you who have contracts with the federal government can begin to report immediately to the federal government violations. You don't have to wait for new regulations. This isn't complicated. All they have to do is do a word processing search and change 18 to 21. And if they were as efficient as Governor Cuomo said people should be, it would happen tomorrow. Equally important, I don't want anyone to be misled into thinking that the partial action taken with regard to some flavored e-cigarettes solves the problem. It doesn't. That's why states like Massachusetts and New Jersey that have recently banned the sale of flavored e-cigarettes, Rhode Island and Montana that have emergency orders in place to do so, and a number of other states that now have legislation pending or are considering legislation pending to ban the sale of flavored e-cigarettes needs to be a very high priority from a public health standpoint. Don't kid yourself. The only e-cigarettes that kids use are flavored e-cigarettes. The data that get reported, while extraordinarily high, in one study it says 97%, is actually low. You won't find a kid who uses a non-flavored e-cigarette. The industry knows it. Second, what did the new federal action actually cover? It only covered the e-cigarettes that come in closed pods that already have flavored nicotine in them. What doesn't it cover? That is very important for you to understand. I have in front of me a series of products which are called disposables. They call them as single use, but that's a misnomer. Each of these is a product that a kid purchases for $8 to $9 and then throws away after use. But what does single use mean? Each one of these is roughly a pack and a half to 2 packs of cigarettes worth of nicotine in it. It comes with higher doses of nicotine often than Juul, which means the addiction potential is massive. And does it come in flavors? This one is blueberry, this one is mango, this one is cotton candy, this one is pink lemonade. None of these are touched by the new federal priorities. Second, here are 2 products that are also e-cigarettes. You probably wouldn't have known it. This looks like a highlighter that a young girl would bring home. I'm not sure what this looks like, but I know it doesn't look like an e-cigarette. In each case, it comes with an empty container. Therefore, it's not covered by the ban. And what is available for those empty containers? Well, here is a liquid nicotine that you pour into here. This one is cotton candy. I've got one that's strawberry, every flavor that you can imagine. These aren't covered. What you need to know is over 10% of the kids are already using these products, so that these products will serve as tomorrow's product for the kids. It is not going to take kids very long to figure out that if you like flavored e-cigarettes, they are as available today as they were yesterday. They are not covered by the new FDA rule, and by the time FDA gets around to it, your kids will be more addicted than you can conceivably imagine. So that I don't want anyone to think that what has happened here lessens the need for action at the state and local level. I think there's another point that I just want to make with regard to it. I've worked on tobacco-related issues for over 35 years. I've worked with then Senator DeWine for almost a decade to give FDA jurisdiction over these products. In those 35 years, I've never seen a crisis hit our teenagers with the depth and the breadth and the seriousness of the e-cigarette crisis. There is not a high school, middle school, or community in this country that isn't facing it. The other thing that's important to understand is those who manufacture these products and sell them are very loud, and they're a very small number. The reality is, when you actually poll this number, whether you're in a Republican or Democratic, rural or urban, Western or Eastern state, the numbers show that parents in this country are demanding action and will favor anybody who takes action. This one is not a Republican or Democratic issue, and it's not a conservative or liberal issue. Moms and dads across this country are terrified, partially because of those serious lung diseases, but even more so because they're seeing their kids suffer symptoms of addiction and withdrawal more intense, more serious, and more immediate than we have ever seen before. So if I have a single caution to all of you, is this, if ever, this was not the time for you to let the federal government take over your responsibility here, your opportunity here. Last year alone, 1.5 million more kids became addicted to e-cigarettes than the year before. The year before that, 1.5 million more kids became addicted. We have more kids addicted to nicotine today than at any time in this century. This is one of those crises that we know how to reverse it. Enact legislation on your own to raise the age to 21, ban all of the flavored products without exception. What the industry doesn't tell you is that prior to the introduction of these flavors, those who were adults who were trying to quit were using tobacco flavor. Therefore, we're not taking products away from kids. Last point. The Surgeon General last month issued a report on e-cigarettes. What it found was very important. It found that the evidence is inadequate to conclude that e-cigarettes are actually effective at helping adults quit. So that by tackling this problem and protecting your kids, you will hear rhetoric, but the data says you are not interfering with the effort of adults who want to quit. The FDA has a role to play there. I hope they play it. But in the end, if action isn't taken quickly, we're all going to wake up in 10 years and wonder how 30 million of our kids became addicted to these products. So I want to say, I think all of us in the public health community, we at the Campaign for Tobacco-Free Kids, stand ready to help you any conceivable way we can. This is one of those issues that what you do over the next 12 to 24 months will impact the health of our children for the next 20 years. Thanks.
Thank you. Thank you very much for your very insightful
you know
and
what?
compelling.
Let me do one quick show and tell. Many people think I'm wearing an Apple Watch.
Oh my gosh.
Let me push a button on this watch, pick up the top, which actually tells time, take it apart, and it's an e-cigarette. Put it together, smoke it, and it's not covered by the new FDA action. So if you want a clue how clever this industry really is, if we don't get ahead of it, boy, will they get to our kids quickly. Thanks.
My gosh. All right. Holy smoke. I see lots of hands going up. Governor Polis.
Thank you. You know, I was a co-sponsor of that Henry Waxman bill 10 years ago that gave the regulatory authority on the tobacco products. In seeing some of this stuff, which I hadn't seen before, the watch, all that, how do we make sure, whatever we're doing, that we're not playing whack-a-mole, where we're doing it around something, it's vaping, and then all of a sudden it's back in another form, another way we never thought about it? Is it the nicotine content in any medium, or is there some way that we can not just deal with today's and yesterday's problem, but do it in a way where it doesn't pop up the next day in a different way that we never thought of?
It's a great question. And so there's a series of steps, none of them which are perfect, but I think several of which will guarantee you results. One is you need to ban all flavored e-cigarette products and the devices that deliver them. clearly without exception. I want to credit Massachusetts and New Jersey. They did a good job. Others have gotten there. There is model legislation to do it. 2, if you have the authority to do so, the reality is the crisis has also been fueled by the fact that these companies are delivering higher levels of nicotine. In the United States, the nicotine delivered is 3 times the legal limit of what is permitted in the European Union and the United Kingdom. There's a lot we don't know about the perfect level, but we do know that in the European Union and the UK, they're not seeing the youth crisis that we have seen. It's in part because they limit it to 20 milligrams of nicotine per milliliter. Juul has 59 milligrams per milliliter, and several of the products I've shown you here, all of which, by the way, are made in China, to reference back to your earlier comment, earlier session, has even higher levels of nicotine. So get rid of the flavors because they attract kids. Limit levels of nicotine if you can, so that those kids who experiment don't become heavily addicted and have no exceptions.
Thank you. Governor Baker, you've been extremely active. We'd love to hear lessons learned and any challenges you can share with the rest of us.
Well, first of all, it's funny how these jobs work. You get surprised. And on this whole issue with vaping, we just started to see some of the data that was coming out of the national CDC and the FDA about injuries and deaths associated with vaping. And then in last fall and early September, we started collecting it through our own Department of Public Health. And one of the things we learned was that nobody in the medical community ever asked anybody if they vaped when they showed up with a lung injury, because it never occurred to them that that might have been what caused it. Once they started asking, the numbers started to climb. And at the end of September, we had a bunch of people in, pulmonologists, pediatricians, researchers, and just said, tell us what you know. And the overwhelming message we got from all of them was that vaping, the fundamental act of vaping by itself, has risks because it's a liquid chemical compound that you are vaporizing, then pulling into your lungs, which are not built to deal with liquid in the first place, and then pushing it out. And there's a lot of evidence that in both the legal products and the black market products, there are microbial toxins in there that are just not good for your lungs. And the message they gave to me was, you need to do something now. And we talked a lot about what to do, and we eventually decided to put a temporary ban in place, 40 days, which was admittedly a big stroke of action. But honestly, I couldn't figure out any other way to get people's attention and at the same time create some urgency around doing something. And for my fellow governors, I guess what I would say is, there are a lot of people who are really unhappy with me when I did this, and I heard from them. But the thing you should know is parents, teachers, school nurses, almost anybody in the medical community would literally chase me down on the street or in a hallway or in a restaurant and give me a hug and thank me for what I was doing. The people who are closest to this know it's an enormous problem, and they were so glad that somebody was finally putting it in front of the public. And our legislature acted within 30 days of us executing the ban, and our legislation basically bans flavors, really restricts where you can purchase these products, period, to over 21 locations, and gives the Department of Public Health the ability to make sure we create what I would call sort of a public information campaign that lays out a lot of the issues associated with what some of the dangers associated with vaping are. But the most compelling comment I got from that first meeting with all those clinicians was, a woman who was a cancer doc, and her husband was a pediatrician, and she said her kids believed that vaping was safe. And she's not safer, safe. And I think one of the greatest challenges we all have in this space is helping people understand that really easy to use nicotine products that deliver a pack and a half of nicotine in a cartridge probably aren't safe, in addition to some of the issues just associated with what we don't know yet about long-term use associated with vaping.
Thank you, Governor. Your leadership on this issue is critical. And it's the other reason to get rid of flavors is flavors are part of what makes a kid think it's safe. If it tastes sweet and goes down smoothly, how harmful can it be? You know, the Surgeon General in January issued a report. These are not safe. There's a lot we don't know, but what we do know is that inhaling high doses of nicotine, was particularly with young lungs, is by nature harmful to the long-term health of their nicotine, their health. The other thing is these are perfect drug delivery devices. And no one should kid themselves either that if these devices are out there, kids are going to figure out what else goes in them, so that the crisis that we had last summer may or may not have been largely caused by other substances in it. But if you've got a device that delivers substances this well, you can be pretty well sure someone is going to figure out how to deliver it.
Thank you. Governor Lamont, you've also been very active. Please tell us what you're doing in your home state of Connecticut.
Thank you, Governor Brown. Yeah, I thought cigarette addiction was maybe behind us 10 years ago, and now I see it's just being turbocharged by the vapes and the flavored vapes and Mr. Meyer's explanation of how much more powerful and addictive this is. I just follow on what Governor Baker said, where a lot of people think it's safe. I think we're sending a bit of a mixed message out there right now. You know, I'd love the FDA to be bold and clear in terms of what we can do and what we can't do and what is safe and what is unsafe. Some people think it's probably safer than cigarettes or gets you off of cigarettes. There's some mixed messaging out there. And one of the things I'm trying to do, because I come from a small state, is work with Charlie and work with Governor Cuomo and work with Tom Wolf and work with some of our neighboring states, see what we can do on a regional basis. Because what I can try and outlaw or set for one small state doesn't make as much sense if all you got to do is drive 30 miles across the border to take care of that. So we'll take the lead, as Mr. Myers said. You know, there's yin and yang between what states the laboratory of democracy and the feds, and we're going to take the lead, and hopefully the feds keep following and send a clear message for us.
I think that's terrific, and there is a real opportunity with Massachusetts having acted, with Rhode Island with having an emergency rule in place that hopefully will become permanent, hopefully with Connecticut. New York City recently banned these, and under Governor Cuomo's leadership, New York State has legislation pending to do so.
Didn't New Jersey do it too?
New Jersey has already done it. Second week of January of this year, New Jersey did it, and legislation has been introduced in Maryland, Delaware, and the District of Columbia, so that we have the potential to have real change and be able to see the impact of it. And hopefully that's only the beginning.
And in the end, as Governor Lamont said, I think we would all hope that the FDA would come around so that we have a national solution to this. And we would hope that they would do it in a way that's consistent with the underlying premise for the design of regulation, which should be test the product first before you put it into the marketplace and try it out on our kids, just as we do with pharmaceuticals or medical devices.
Governor Bullock.
Yeah, we know in Montana about 30% of our high school students are regularly using vape, 16% of our middle school students. But I think that we can easily get sort of blinded by statistics. I'd encourage any of you to call a school resource officer or a principal, find out what's actually happening in those schools. I decided I couldn't wait until the legislature, so I did an emergency rule, and I thank Matt for providing an expert, because it was also then immediately challenged in district court. We didn't make it about government versus business. We made it about pediatricians and kids, and one of the lines from that opinion was despite statements from officials at the federal level that some regulatory action would be taken to address the youth nicotine crisis, none has occurred. The mere existence of flavored vape liquid in the market creates the immediate peril to youth, and no other administrative act could remove it from the hands of youth. So if anyone wants to see both the rule and the district court opinion, because it has great language about the risks and why we as governors need to take action, to reach out, and I'd be more than happy to get it to you.
Thank you, Governor Bullock. Any comments from our panel? Any other governors? Questions, comments? Well, I want to say thank you to our extraordinary panelists for joining us this afternoon, for their passion and determination. Really appreciate their participation. Want to say thanks to all of you for joining us this afternoon, but I am required to do a public service announcement before we close out this particular session, and that is on behalf of Governor Hogan. We look forward to all of the governors joining us in room 206 at Governor Hogan's Chairs Initiative Advisory Council Roundtable. And with that, we're actually adjourned early, so please enjoy your few minutes break, and we'll see you all at the Chairs Initiative Roundtable. Thank you all very much.
Good job.
Thank you.
Yeah.
So